Have you ever noticed how a disease can suddenly dominate headlines, spark fear across social media, and instantly bring back memories of the early days of the COVID pandemic? That's exactly what happened after reports emerged of a hantavirus outbreak connected to a cruise ship, raising serious questions around the world. People immediately began asking the same things. What exactly is hantavirus? How dangerous is it? Can it spread between humans? And perhaps the biggest concern of all, could this become another global crisis? The situation became even more alarming after several passengers reportedly lost their lives, pushing health officials and medical experts to investigate where the virus came from and whether more infections could appear in the coming days. While the story has triggered understandable concern, experts say it's important to separate fear from facts and understand what this virus really is before jumping to conclusions. Hantavirus is not a completely new disease. In fact, scientists have known about it for decades. The name itself comes from the Hantan River in South Korea, where the virus was first identified. But what many people don't realize is that hantavirus is not just one single infection. Instead, it refers to a whole family of viruses. According to the World Health Organization, researchers have identified around 20 different hantavirus species worldwide. Some are more dangerous than others, and certain versions are found only in specific regions. Despite how serious it can become, the infection remains relatively rare compared to many other viral diseases. Still, when cases do appear, they attract immediate attention because of the severe symptoms and high death rates associated with some strains. What makes hantavirus especially concerning is its connection to rodents. Rats and mice are considered the primary carriers, and most infections happen after people come into contact with areas contaminated by rodent urine, saliva, or droppings. In many cases, individuals become infected while cleaning spaces that have been infested with rodents for a long period of time. Imagine entering an old cabin, an abandoned building, a storage shed, or even a barn that hasn't been cleaned in months. If infected rodents have been living there, tiny virus particles from dried waste can become airborne when dust is disturbed. Once inhaled, the virus can enter the human body and begin causing illness. Because of this, most reported cases tend to happen in rural environments such as forests, farms, and fields where rodents are more common and opportunities for exposure are much greater. The recent outbreak linked to the cruise ship has created even more questions because investigators still do not know exactly where the infections started. That uncertainty is one reason the story has gained so much global attention. All confirmed cases appear connected to the cruise ship known as the MV Hondius, which departed from the southern tip of Argentina at the beginning of April. But health experts are carefully examining the movements of the passengers before they boarded the vessel. Early reports revealed that the first fatalities, a Dutch couple, had traveled through parts of South America before joining the cruise. That detail may turn out to be extremely important because one dangerous strain known as the Andes virus has already been identified in both Argentina and Chile. The Andes strain stands out because it behaves differently from many other hantaviruses. Most versions spread only through contact with infected rodents, but Andes virus has shown evidence of limited human-to-human transmission in rare situations. This is one of the reasons health officials are monitoring the situation so closely. There is already historical evidence showing how quickly this specific strain can move through close human contact under certain conditions. One major example happened in Argentina in late 2018. Investigators eventually traced an outbreak back to a single social gathering where one infected individual unknowingly spread the virus to others. The result was devastating. 34 confirmed cases were eventually linked to that event, and 11 people died. Incidents like this explain why experts are being extremely cautious, even though the overall risk to the global population is still considered low. Naturally, one of the biggest questions people ask is whether hantavirus is airborne. The answer is complicated because the virus is not airborne in the same way diseases like COVID-19 spread through casual breathing and conversation. Instead, hantavirus becomes airborne indirectly. When rodent waste dries out, tiny contaminated particles can mix with dust and enter the air. A person cleaning an infected area might inhale those microscopic particles without even realizing it. That's how most infections occur. So, while the virus technically travels through the air under certain conditions, the primary source remains infected rodents rather than widespread human transmission. This distinction is very important because it changes how health officials approach containment and prevention. Even so, the rare cases involving Andes virus have raised concerns because they suggest human-to-human spread is at least possible in limited circumstances. Researchers believe close contact may be required for transmission between people, which is very different from highly contagious respiratory viruses. Still, whenever scientists counter a virus capable of crossing between humans, even rarely, they take the threat seriously. Cruise ships, in particular, create unique challenges because passengers share dining areas, cabins, and enclosed spaces for extended periods of time. That close environment naturally increases concern whenever any infectious disease appears on board. The symptoms of hantavirus can also be frightening because the illness often begins in a way that feels surprisingly ordinary. Early signs resemble common flu symptoms, making the infection difficult to recognize at first. People may experience fatigue, fever, muscle aches, headaches, dizziness, chills, nausea, or stomach discomfort. At this stage, someone might easily assume they have a seasonal virus or food poisoning. But for some patients, the condition can suddenly become much more severe after those early symptoms appear. That transition is what makes hantavirus especially dangerous. One major form of the disease is called hantavirus pulmonary syndrome. In this condition, respiratory problems begin developing rapidly. Patients may start struggling to breathe as fluid builds inside the lungs, making oxygen levels drop dangerously low. Breathlessness becomes severe, and many patients require immediate hospitalization. According to the Center for Disease Control and Prevention in the United States, the mortality rate associated with this form of the illness is around 38%. That means more than 1 out of every 3 infected individuals may not survive, even with medical treatment. Those numbers alone explain why outbreaks immediately attract global attention, despite being relatively rare overall. Another form of the illness is considered even more dangerous. Known as hemorrhagic fever with renal syndrome, this version primarily attacks the kidneys and can lead to catastrophic complications throughout the body. Patients may develop dangerously low blood pressure, internal bleeding, and acute kidney failure as the infection progresses. In the most severe cases, dialysis becomes necessary to keep patients alive while doctors attempt to stabilize their condition. The mortality rate for this form can approach 50%, meaning half of infected individuals may die. As health officials continue monitoring the situation aboard the cruise ship, concerns remain high about whether additional passengers could begin showing symptoms in the coming days. As investigators continue trying to understand exactly how the infections connected to the cruise ship began, medical experts are paying close attention to who may face the greatest danger if exposed to hantavirus. One common assumption is that older people are automatically at higher risk, but the reality is slightly more complicated. Age certainly matters when it comes to any severe infection, especially for individuals who are already frail or living with chronic health conditions. Someone with heart disease, lung problems, diabetes, or a weakened immune system may struggle more if the virus attacks the body aggressively. But what makes hantavirus particularly alarming is that it can also become deadly in otherwise healthy adults. Unlike some illnesses that mainly threaten vulnerable populations, hantavirus has shown the ability to cause rapid deterioration even in people with no major medical history. That unpredictability is one reason doctors treat every suspected case very seriously. The danger often lies in how quickly the illness can escalate after symptoms first appear. A person may initially feel only mild fatigue or muscle pain and assume they simply caught a seasonal flu. Then, within a short period of time, breathing problems or organ complications can suddenly emerge. In many cases, patients do not realize how serious their condition has become until the infection has already advanced significantly. That rapid progression creates enormous pressure on medical teams because early recognition and immediate supportive treatment can make a major difference in survival chances. When doctors suspect hantavirus, testing becomes critical. Since the symptoms can resemble several other viral infections during the early stages, physicians rely on laboratory analysis rather than symptoms alone. The primary diagnostic method used is called a PCR test, a term many people became familiar with during the COVID-19 pandemic. During that period, millions around the world experienced nasal or throat swabs as part of routine testing, and the same scientific principle is used for hantavirus detection. PCR stands for polymerase chain reaction, a powerful molecular biology technique capable of identifying extremely small traces of genetic material. What makes PCR testing so effective is its ability to amplify tiny amounts of viral DNA or RNA into millions, sometimes billions, of copies that can then be analyzed in a laboratory. Even if only a minute sample of the virus exists inside the body, PCR technology can often detect it with remarkable accuracy. This allows health professionals to confirm infections earlier than older testing methods could. In outbreaks like the one connected to the cruise ship, rapid testing is essential because officials need to identify infected passengers as quickly as possible in order to monitor close contacts and prevent additional spread. Still, diagnosing the virus is only one part of the challenge. One of the most concerning realities surrounding hantavirus is that there is currently no specific cure designed to eliminate the infection itself. Unlike bacterial infections that can often be treated directly with antibiotics, viral illnesses are far more difficult to target. At present, there is also no widely available vaccine capable of fully preventing hantavirus infection. That means doctors must focus primarily on supportive care, helping the body survive while the immune system attempts to fight off the virus naturally. Supportive care can involve a wide range of medical interventions depending on how severe the illness becomes. For patients struggling to breathe, oxygen therapy is often one of the first steps. In more serious situations, mechanical ventilation may be necessary if the lungs begin failing to provide enough oxygen to the body. Intensive care specialists may place patients on breathing machines while carefully monitoring heart function, oxygen levels, and fluid balance. Because hantavirus pulmonary syndrome can fill the lungs with fluid very quickly, respiratory support sometimes becomes the difference between life and death. For patients suffering from hemorrhagic fever with renal syndrome, the focus shifts heavily toward kidney support and stabilizing blood circulation. Acute kidney failure is one of the most dangerous complications associated with this form of the disease. When the kidneys stop filtering waste properly, toxins begin accumulating inside the body, creating potentially fatal consequences. In such situations, dialysis may be required. This procedure uses specialized medical equipment to filter the blood artificially while doctors work to manage the infection and support recovery. Some patients also require intravenous fluids, medications to stabilize blood pressure, and intensive monitoring for internal bleeding. Researchers have studied antiviral medications as possible treatments in certain cases, but results remain mixed, and no universally effective therapy has been approved specifically for hantavirus. That reality can sound frightening, but it also explains why public health officials place so much emphasis on prevention. Avoiding exposure to infected rodents remains the single most effective defense against the disease. In rural areas where hantavirus has historically appeared, experts recommend wearing protective equipment while cleaning enclosed spaces that may contain rodent waste. Proper ventilation, disinfecting contaminated surfaces, and avoiding actions that stir up dust are all considered important preventive measures. As news coverage of the outbreak spread online, another question quickly began circulating among the public. Could this become another pandemic? The comparison to COVID-19 appeared almost immediately, especially because cruise ships once again became associated with fears of infectious disease. During the early stages of the coronavirus pandemic, cruise vessels gained global attention after multiple outbreaks occurred on board, leaving thousands of passengers quarantined at sea. Those memories remain fresh for many people, which helps explain why the recent hantavirus cases triggered such emotional reactions. But according to health experts and the World Health Organization, the current risk to the broader global population remains low. That point is extremely important because public fear can often spread faster than the virus itself. While hantavirus is unquestionably dangerous for those infected, it does not appear to spread with the same efficiency as highly contagious respiratory viruses like COVID-19. Most hantavirus infections still originate from contact with infected rodents rather than casual interaction between humans. Even with the Andes strain, where limited human-to-human transmission has been documented, experts believe close contact is generally required. This dramatically reduces the likelihood of widespread international transmission on the scale seen during the coronavirus pandemic. Public health agencies are continuing to monitor the cruise ship situation carefully, especially because outbreaks in confined environments always require caution. Passengers and crew members who may have been exposed are being evaluated for symptoms, and authorities are watching closely for any sign that additional cases could emerge. Epidemiologists are also tracing travel histories and potential exposure points in order to understand whether the infections originated on board or before passengers even boarded the ship. That investigation could ultimately reveal whether the outbreak resulted from environmental exposure during travel in South America or from close human contact afterward. At the moment, experts stress that there is no indication the world is heading toward another lockdown scenario because of hantavirus. The biology of the virus, its transmission patterns, and the relatively small number of confirmed cases all suggest a very different situation from what the world experienced in 2020. Still, the outbreak serves as a reminder of how closely human health remains connected to the environment around us. Diseases carried by animals continue to pose challenges in many parts of the world, especially as people travel more frequently and interact with wildlife habitats in new ways. For many viewers following this story, the most unsettling part may simply be realizing how dangerous a relatively unfamiliar virus can become under the right conditions. Hantavirus may not dominate headlines every year, but when outbreaks happen, the consequences can be devastating for affected families and communities. That is why scientists, doctors, and global health organizations continue studying these infections carefully, searching for better treatments, improved prevention strategies, and faster ways to contain future outbreaks before they grow into larger emergencies. What makes outbreaks like this especially unsettling is not only the danger of the virus itself, but also how quickly uncertainty can spread among the public. The moment people hear words like deadly virus, cruise ship, and human transmission, memories of previous global health emergencies immediately return. Social media becomes flooded with rumors, worst-case scenarios, and fear-driven speculation. But infectious disease experts continue emphasizing the importance of staying grounded in evidence rather than panic. Understanding how hantavirus behaves is the key to understanding why health officials are concerned, but not alarmed to the level of declaring a worldwide emergency. One major reason experts remain cautious rather than panicked is because hantavirus transmission works very differently from viruses that spread rapidly through casual contact. Diseases like influenza or COVID-19 can move efficiently from person to person simply through respiratory droplets during normal conversation, coughing, or even breathing in close spaces. Hantavirus does not typically behave that way. In the vast majority of known cases, the infection begins with direct environmental exposure linked to rodents. This means outbreaks tend to stay localized rather than exploding globally across populations. That said, localized outbreaks can still become extremely dangerous under the wrong conditions. In areas where infected rodent populations are present, even a small lapse in awareness can expose multiple people. A family cleaning an old cabin, workers opening abandoned storage buildings, or travelers staying in poorly maintained rural accommodations may unknowingly inhale contaminated particles without ever seeing a single rat or mouse. That hidden risk is part of what makes the virus so difficult to detect early. By the time symptoms appear, exposure may have happened days or even weeks earlier. Medical researchers have spent years studying why some hantavirus strains cause such severe illness once they enter the body. The answer largely comes down to how aggressively the immune system reacts. In many serious infections, the body's own immune response contributes heavily to the damage. When the virus attacks the lungs or kidneys, the immune system releases inflammatory chemicals meant to fight the infection. But in severe cases, that response becomes overwhelming. Blood vessels may begin leaking fluid, organs can lose function, and oxygen levels may collapse rapidly. This chain reaction explains why patients sometimes appear stable at first and then suddenly deteriorate in a very short period of time. For doctors treating hantavirus pulmonary syndrome, one of the greatest challenges is managing respiratory failure before it becomes irreversible. As fluid builds inside the lungs, breathing becomes increasingly difficult. Patients often describe a feeling of pressure or suffocation as oxygen levels fall. Intensive care units must respond quickly because once severe lung involvement develops, survival depends heavily on rapid respiratory support. Mechanical ventilators are frequently used to keep oxygen circulating while doctors attempt to stabilize the patient's condition. Even with advanced medical care, however, the mortality rate remains disturbingly high. The kidney-related form of the disease presents a completely different but equally dangerous battle. Hemorrhagic fever with renal syndrome attacks blood vessels and kidney tissues, causing circulation problems throughout the body. Low blood pressure can become severe enough to threaten organ function, while internal bleeding creates additional complications. Patients may produce very little urine as kidney failure develops, signaling that the body is losing its ability to filter toxins properly. In these cases, dialysis machines temporarily take over the kidney's role, helping remove waste products from the bloodstream. Without that support, many patients would not survive long enough for their bodies to recover naturally. One important point experts continue stressing is that hantavirus outbreaks are not new phenomena. Cases have been documented in different regions of the world for decades. Parts of Asia, Europe, and the Americas have all reported infections at various times. In the United States, hantavirus first gained widespread national attention during the early 1990s after a deadly outbreak occurred in the Four Corners region, where Arizona, New Mexico, Colorado, and Utah meet. Several young and otherwise healthy individuals developed sudden respiratory failure, leaving doctors initially confused about what was happening. Investigators eventually traced the illnesses back to rodent exposure, leading scientists to identify a previously unknown hantavirus strain in North America. That outbreak transformed the medical community's understanding of the disease. Researchers realized that environmental conditions could strongly influence infection risk. Increased rainfall had led to a rise in vegetation, which caused rodent populations to grow rapidly because food became more abundant. More rodents meant more opportunities for humans to encounter contaminated waste. This connection between environmental changes and disease outbreaks remains extremely important today. Climate patterns, habitat disruption, and human expansion into rural environments can all influence how often humans come into contact with disease-carrying animals. The cruise ship investigation may eventually reveal similar environmental factors playing a role. Because some passengers traveled through parts of South America before boarding, health officials are carefully examining where exposure may have occurred. Rural tourism, hiking excursions, eco-lodges, or visits to remote locations could all potentially create opportunities for rodent contact. Infections linked to the Andes strain have previously appeared in Argentina and Chile, making that regional connection especially important for investigators. At the same time, authorities are also evaluating the possibility of limited onboard transmission between passengers. Although rare, the Andes strain remains one of the few hantaviruses known to spread between humans under certain conditions. Scientists still do not fully understand why this particular strain behaves differently from others. Some studies suggest prolonged close contact may be required, possibly involving exposure to bodily fluids or respiratory secretions during advanced illness. Even so, experts emphasize that the transmission efficiency appears far lower than highly contagious airborne viruses. This distinction matters enormously when assessing global risk. During the COVID-19 pandemic, a single infected traveler could unknowingly spread the virus to dozens of people in airports, restaurants, offices, or public transportation within days. Hantavirus has never demonstrated that kind of transmission pattern. Most outbreaks remain relatively contained because infections are tied closely to specific exposure events rather than widespread casual contact. That is one of the main reasons the World Health Organization currently considers the overall public threat to be low, despite the seriousness of the reported cases. Still, the psychological impact of outbreaks like this cannot be ignored. Many people now live with a heightened awareness of infectious disease after experiencing lockdowns, quarantines, and years of pandemic-related disruption. News about any unusual virus naturally triggers anxiety, because the world has already seen how quickly a local outbreak can transform into an international crisis. Cruise ships, in particular, have become symbolic in the public imagination because of the outbreaks that occurred during the coronavirus pandemic. Seeing another virus connected to a cruise vessel instantly revives those memories. Health communication experts say this is exactly why accurate information matters so much during situations like these. Public fear often grows strongest when information is incomplete or confusing. That is why medical authorities continue repeating a balanced message. Hantavirus is unquestionably dangerous for infected individuals, but there is currently no evidence suggesting the world is facing another pandemic scenario. Monitoring continues because caution is necessary, not because catastrophe is inevitable. In the meantime, scientists are continuing research aimed at improving future treatments and prevention methods. Developing antiviral medications that directly target hantaviruses remains a major goal, although creating effective therapies for rare diseases can be challenging. Vaccine research is also ongoing in several countries, particularly in regions where outbreaks occur more frequently. Researchers hope that advances in molecular biology, genetic sequencing, and immunology may eventually produce faster diagnostics and more effective medical interventions. Until then, awareness remains one of the strongest protective tools available. Understanding how hantavirus spreads allows people to reduce risk significantly. especially in environments where rodents may be present. Proper cleaning procedures, protective masks, gloves, ventilation, and safe handling of contaminated areas can dramatically lower exposure chances. Simple preventive actions may sound small, but in the case of hantavirus, they can truly become life saving measures as the investigation surrounding the cruise ship outbreak continues to unfold.